Bismillahirrahmanirrahim. Assalamu alaikum, dear all students. I am Zakirullah, lecturer in medical laboratory technology. Today we will discuss the topic collection and safety of microbiology. In today's topic, we will learn about what are the different type of specimens which is collected by patient themselves, how to collect these samples and how to guide the patients. Our second learning point will be labeling and requisition or the documentation of these collected specimen, how to label, what is the requirement of a request form, and the third learning point is the safety of the patient, the safety of the specimen, as well as the safety measurement for the personnel who is transporting, who is processing the sample. These are the major learning points of today's topic. Coming to the patient collected specimen. Specimen collected by the patient themselves should be done with the assistance from the medical personnel. A person who is the front desk officer of the lab or who is available for the guidance of the patient, he should guide the patient how to collect different type of specimen. And for this assistance, for this guidance, the most effective method is to provide a verbal and written instructions, because sometimes there is a deficiency in reading, a deficiency in the understanding of the words. So verbal communication is very important for guidance of the patient or their attendants during collection of specimens which are to be collected from the patients. This written English or language, it should be very simple and easily understandable by the patients or their attendants, and also it is good to understand the patient with the help of picture of the procedure, if uh, just like it was explained verbally. For example, if you are giving uh, instructions for the patient about a urine collection, so first guide him verbally, and also if there is any written instructions, so attend and tell him to read these instructions, and if there are picture of these instructions, so that will be good for the understanding of the patient. The most commonly specimens which are obtained by the patient themselves, these are urine, sputum and stool. These three samples are most commonly collected by patient themselves. The urine specimen, urine collection must have explanation of the clean catch midstream urine. The healthcare worker or the laboratory worker, he should explain that how to collect a urine by the patient. He should explain that the patient should collect the midstream urine and that should be a clean catch midstream urine. For example, if a patient comes to you and tell him that this is a container for the collection of urine, you have to void the first part of the urine and then collect the middle part of the urine in the container, and then also void the last parts or the last drops of the urine. So this is how to explain the patient to catch the midstream urine. For urine collection and urine examination, the first morning specimen is preferred because it provides a very concentrated sample, and also all the nutrients which is present in the urine, and all night during the sleep urine is collected inside the urinary bladder. So all the components which are present in urine can be seen, can be examined, and microscopically certain structures they are very good to examine in the morning specimen. For urine collection, first the external genitalia is cleaned to reduce the presence of normal flora, because we know that our skin is resided by the normal flora, different type of bacteria or some type of yeast cell. So by washing the external genitalia, the normal flora is removed. Now void without collecting the first portion of the urine flow, and if the first portion of the urine flow it is voided without collecting, it helps in washing the contaminants or the contaminants of the urethra. If there is any normal flora or any contaminants in the urethra, so that is washed with the help of the first portion of the urine, and then collect the middle portion of the urine. Coming to the sputum, the sputum is usually collected for the diagnostic of bacterial pneumonia and also the lower respiratory tract infections. The lower respiratory tract specimens, they are very difficult to collect adequately because of the patient have to try, and he have to try harder for the collection of this type of specimen. And these lower respiratory tract specimens, they are usually contaminated with the normal flora of the oropharynx, of the laryngopharynx, yet or the normal flora of the pharynx. And the lower respiratory specimens, they are one of the least clinically relevant specimens received for culture due to the contamination or the presence of the normal flora. The blood or bronchoalveolar lavage, these are the accurate and preferred method for the detecting of the etiologic agent which have caused the disease. So in case of lower respiratory tract, usually a sputum specimen is given for the examination or for the culture processes, but blood or bronchoalveolar lavage, it is preferred for the culturing because it gives us accurate and good results of the etiologic agent or the pathologic agent. For sputum specimen, the first morning specimen is very preferred because all the contents whole night the sputum is collected and every possible pathogen may be present in the first early morning specimen. For that purpose, you have to educate the patient, you have to guide the patient about the difference between the sputum and the spit or saliva, because for sputum you have to give a deep cuff. Sputum is given with a deep cuff, whether saliva or spit it is present in the oral cavity or in the mouth. Patient should rinse the mouth and expectorate with a deep cuff directly into the sterile container. The container should be sterile, it should be clean and sterile, and it should have a wide mouth, and the patient should expectorate into it with a deep cuff. If a patient have dentures, so their dentures should be removed before expectorating or before giving the sputum sample. In case of suspicion of any bacterial infection, a simple sputum specimen is adequate for the examination for the culture purposes. But if there is any fungal or mycobacterial infections, then 3 separate early morning specimens for the successive days are appropriate. For example, in case of fungal or mycobacterial infection, we have to examine the sputum. For first day, we have to examine either there is any fungal or mycobacterial pathogen present or not. If it is present, then it is reported. And if it is not present, then for the second day, the sputum is again examined, and the same process is repeated for the third day. So this is the standard procedure for the examination of sputum for the fungal or mycobacterial infections. The healthcare professional or the medical personnel, they could assist the patient who are unable to expectorate a respiratory specimen, and these specimens may be collected through aerosol induction. In this process, the patient breathes, inhales the aerosolized droplets of a solution, and this solution stimulates the cough reflex. So the sputum is expectorated, and that type of sputum is induced by this aerosol induction. So that type of sputum is called induced sputum. And then when the sample is sent to the lab, so the lab should be informed that whether the sample or the specimen is normal expectorated, or it is expectorated by a cough reflex, or it is an induced sputum. So the lab should be informed about the collection procedure. Our third specimen is stool specimen. It is the choice of specimen for the detection of gastrointestinal pathogens, which causes any diseases in our gastrointestinal, small intestine, large intestine, or stomach infections. We can also take a rectal swab with having atresis or slightly feces, and they should be submitted for the culture of bacteria. Single specimen is not sufficient to exclude bacteria or parasite because it can miss our bacteria or parasite, or due to certain errors our bacteria or parasite may be lost. So single specimen is not sufficient. For bacterial infection, 3 specimens should be collected, 1 a day for 3 days. If we are suspecting a bacterial infection in the gastrointestinal tract, and just like in case of sputum, we examined 3 specimens for 3 consecutive days, same case will be here for the bacterial infection in the gastrointestinal tract. We have to examine the bacterial the stool sample for 3 consecutive days. If a parasite is suspected, 3 specimens collected within 10 days, and that is sufficient for the microscopic detection of ova and parasite. Patient, they should be instructed to excrete directly into the container for the collection of stool specimen, and it should be understood that never take specimens from the toilet and should not be contaminated with the urine, because if a stool specimen is taken from the toilet, so a toilet contains millions and billions of bacteria, which is contaminating our stool specimen, or which is different to understand that which one bacteria is part of the disease process and which is the part of the normal flora, and which bacteria is taken from that toilet. So never take specimen from the toilet. And also the contamination of the urine, it also disturbs our results, so urine contamination should also be avoided. For preservation of stool specimen, stool versus preservative ratio is a 1:3, and the stool should be well mixed with these preservatives. And if there is a requirement of parasites microscopy, so these microscopy should be performed before doing any studies with the barium or such kind of chemicals. If not feasible, if the parasitic microscopy of the stool specimen is not feasible before barium studies, so the stool specimen should be delayed for about 4 to 5 days to clear the barium from the stool, because the barium appear as a white chalky substance in stool, and that covers the appearance of parasite under the microscope. So this is the issue with the barium, that covers the substances, the constituents of the stool. That's why the sample is delayed for few days. After taking the samples, what are the requirement of labeling and how the request form is sent to the laboratory, and what are the requirements for a request form? The correct patient identification, it is important to be mentioned on the specimen for the proper processing of the specimen, and the label must contain sufficient information for the specimen, and requisition must be matched. If there is any misunderstanding, or if there is any mismatching between the labeling of the container and the labeling of the request form, very valuable time is lost, and sometimes the specimens of very important nature, they are lost. So these should be corrected, and this should be labeled, because if any unlabeled or mislabeled specimen is sent to the lab, so it can create disturbance, and very time is consumed for correction of this unlabeling or mislabeling. Identification information include a label on a container, and these information must have the name of the patient. In certain cases, the name is not mentioned, the identification number, the hospital identification number or the lab identification number, the ward number or room number along with the bed number, and who is the physician which is taking care, which is treating the patient, and who has referred the patient, and who has advised the test, from which body site the culture or the sample is taken, what is the date of collection of the sample, and what was the time of collection. So all these information, it should be mentioned on the container, or if it is a swab, culture swab or something like that. On the request form, the following information is important. First of them is the patient name. The request form should contain the patient name and the age of the patient along with the gender of the patient, either it is male or female. The patient room number and location, the address, ward number, room number or bed number, the physician name and address which is taking care of the patient and the treating the patient and advising the test for the patient, from which site the specimen is taken and the date of the specimen collection and time of the specimen collection, what is the clinical diagnosis and a relevant patient history to the test which he is performing, and any antibiotics if he is taking or any antimicrobial agent if the patient is receiving, that must be mentioned in the request form. So these are the information which should be mentioned, and name of the individual who is transcribing the orders. This is a sample chart of the request form, the personal health insurance number, patient name, address, the date of birth, the gender. So all these information is written in this proforma. So this is the example of a request form which is sent to the lab along with the labeled sample. For watching, for listening, hope you have learned. If you have any question, you can ask.